Why don't families seek professional help for their loved one's substance use disorder or mental disorder by way of intervention or any other help for that matter? The reason that happens is because of the family system. What ends up happening over time is the family system dismantles, and the substance user or the person with mental health starts to teach the family how to behave. And the family develops those roles that are not labels or diagnoses. They don't define you. They can be treated and they will go away. But for that moment in time, the substance user or the intended patient hijacks the family. When the enabler starts enabling the one person, there's a trickle-down effect. And that trickle-down effect affects everybody else. And other family roles start to develop, which I'm going to get into in just a little bit. Why families don't seek help boils down to the illusion of control, the fear of the unknown change, and the anxiety associated with the situation. Families would rather stay in the situation the way that it is because it's familiar than to have an unknown stranger like ourselves come in, fix the situation, and then have this unknown ending. I've had families tell us that after the intervention, that was what was holding them back, and that is a common denominator. So why families don't get help also is because there's too many people involved. The more people you include in the decision, the further you get away from the decision. And I'll give you a quick example. We'll get a call almost always from a mom or from a sister. What ends up happening is the person will call us, they're ready to go. And then the family will start bringing in other family members who have been disrupted by the trickle-down effect. And all of a sudden now I've got 5 or 6 or even 10 people with a different opinion. And everybody says, oh no, everybody's on board. That has never been the case. They may be on board with changing something, but rarely, if ever, they are completely on board with intervening. So what ends up happening is you talk to that first person and then they go and talk to the others. And everybody who's affected differently has a different look on what's going to happen. And there goes your intervention out the window. It'll never work. They'll never go. They're never going to get sober. There's always an excuse. And families will make more excuses not to hire an interventionist than the intended patient will make when we get there to not go to treatment. 10 to 1 sometimes. Just remember that. Families make more excuses for their loved ones before doing the intervention than the person will give when we get there to ask them to go to treatment. So when you have this dysfunctional family system, everybody is comforted in their role. And what ends up happening is it's counterproductive to the person getting better. So what I'm going to do is I'm going to break down these roles. So the first role I'm going to cover is the enabler. And everybody knows what an enabler is. And the enabler is the role that starts the trickle effect in the destruction of the family system. So the substance user or the intended patient, person with mental disorder, creates chaos and drama. The enabler reacts to it. They develop a role of being needed, they develop a purpose, they develop codependency, and they develop a comfort in helping the person. They actually stop putting attention, love, and affirmation on the other family members. And that's where the whole thing falls apart. And that's where the roles start to develop. So the enabler starts the ball rolling in the breakdown of the family system. And you'll find later in therapy for yourselves that your resentments were not necessarily with the patient, they were with the enabler. The role that is most destructive to the whole family system is by far and wide the hero role. Hero role is almost always the oldest child, not always, but almost always. In the hero, what they do is they become a perfectionist. So their loved one's using substances or acting out mental health, and the enabler is doing everything they can to comfort them, and they have all the attention and eyes on the patient. What the hero does to compensate is they become a perfect person. They try to be the one who has to fix everything. Anytime we get a phone call, and it's not the person who's the hero role calling, and that call ends and the family gets the call, it is always the hero who will sabotage that call or that intervention and be the one who fights the process. And I can identify the hero on the first call, and I will explain to anybody that calls to beware of this. And inevitably, they will still not follow that direction of not including the hero in the decision. and only including them at the intervention. And that one role can literally talk the whole family out of moving forward. Biggest reason why it wasn't their idea. And the other reason why is, I know this will sound crazy, the hero's actually afraid that the substance user will get better, because if they do, their limelight, their spotlight may be stolen from them as the perfectionist. I mean, think about the hero. Let's validate them for a second. They do everything right, or at least try to anyway, and they get very little recognition. The substance user wakes up one day and actually has a good day. And there is a huge praise and all this attention on this little tiny accomplishment, but yet the hero who does everything right gets very little. That actually upsets them. So when they see that, they think in their mind, oh my God, what if they really get well? I am going to be completely lost in the family. That doesn't happen, but that's their fear, and that's why they act out in that role. So keep in mind, it doesn't make them a bad person. It's the role they've acquired. It is a role that can be fixed, and it is not a role that defines them. The next role that I want to cover is the martyr. And the martyr is almost as destructive as the hero. The martyr is the forever victim, and it is often a spouse. The martyr is more worried about what's going to happen to them if their loved one gets well or goes to treatment than they are their loved one getting help at all. When we're on the phone with a martyr, I could say anything by way of a solution, and I'm going to get a yeah, but. I could give a guarantee, and there's going to be a what about this. No matter what you say to the martyr, they're built for this is never going to work, or they don't want it to work. The martyr will be more afraid of how they're going to pay the bills when their loved one's away, or how they're going to provide child care, than getting the substance user or the person with a mental disorder out of the house. So when you have the martyr, they're very, very, very difficult to get on board with the intervention. That's why when people say everybody's on board, no, they're not. They may have said to you, we need to do something. They may have said to you that they can't live this way anymore. They may have said to you that something's got to change until we talk about doing this, and then all of a sudden, nobody does anything. So back to the hero, they're fighting you with their perfectionism. Now the martyr is facing you with their victim mentality. And again, like the other roles I'll discuss, this is not a defined role or a diagnosed role. In other words, it is one you've acquired because of the person who's using substances or acting out mental health disorders, and you can change. So when that call hangs up and you start calling the others against our advice, and you're met with the hero and the martyr, you're going to know where it's coming from. You're going to be met with resistance if you don't hear it on the conference call that we do with your family. Another role that we see that is a clinical role is called the scapegoat. And the scapegoat is kind of opposite the hero. So while the hero goes out of their way to become a perfectionist, the scapegoat says, well, hey, my brother is getting all this attention for being a drug addict. Maybe I should engage in some negative behavior to draw that attention from the enabler. So they start acting out themselves. They're doing it for two reasons. One, they want the attention from the enabler, and two, because they're hurting. So the scapegoat in the family is going to go out of their way to engage in destructive behavior. It may not necessarily even be substance use. It could just be behavior that is not desirable, if you will. They want that enabler to give them attention. Remember, every role is about bringing attention onto themselves, whether it be the hero, the lost child, the scapegoat, or the martyr. Everybody wants attention on themselves. So when you have the scapegoat, they want to be noticed, and that's why they're doing this. Another role, second to last role I'm going to discuss, is something called the lost child. The lost child, again, reacting to the enabler's behavior of giving all of their attention to the intended patient, isolates. They go and hide. Now, a lot of people think they want to do that to escape away from everybody. They don't. They do that because they want you to go find them. There's almost a little bit of lost child in every patient we intervene on, the substance user, the person with mental health. That's why when people say the intervention will never work, they'll never go for it, that is completely false. There's a lost child in everybody. Their emotions of wanting love and affirmation that they've lost because the enabler's given all their attention to one person is why they act out. So what they're looking for is they're going to go hide, and they want somebody to come and find them. That's exactly what the intended patient, the substance user, is doing. Those two behaviors of the lost child and then the substance user are profound. So the next time that you say, they're never going to go or they don't want any help. Completely false. They're just like the lost child. They are dying for your attention. They are trying to rip that enabler away from the patient so that they can get some attention on themselves, just like the other roles. The last role I would like to discuss is the mascot. And what the mascot does is they use humor. They use diversions. They are trying to repair the dysfunctional family system by bringing some sense of normalcy to the situation. The mascot will usually crack jokes or try to make light of the situation. They may even go as far to act like nothing's wrong because they want a normal family. And remember, no matter what the role is, scapegoat, mascot, lost child, martyr, hero, every single role is a trickle-down effect because of the enabler's initial actions to the substance user. Because that enabler has given all of their attention, love, and affirmation to their loved one, everybody is fighting for that attention in a different way. And I have said in every role, what you will find later in life is that your resentments were not so much with your loved one who was using substances or with mental health disorder. They were with that enabler who started the entire trickle-down effect, who disrupted the family system, who dismantled everything. And again, none of these are by choice. These are all default roles that every family goes into. So when you say everybody's on board, they're not. They can't be. They're all going to have a different opinion on what should be done based on the role that they've acquired.